story to a safety alert. The upstate is seeing large numbers of the respiratory illness whooping cough. More than half of the cases in the state are in 4 counties. You see them on your screen there: Spartanburg, Greenville, Pickens, and Anderson counties. These numbers are cases since the start of this year. We've also seen many cases in North Carolina. The Department of Health there couldn't break down it by county, but say we've seen 551 cases so far this year. 55% of those cases are school-aged children, and a high number are among infants as well, which can be very dangerous. And we want to help keep you and your family safe. Dr. Nita Bajor joins us from Oakview Medical Associates in Greenville. Thank you so much for being here today.
Thank you for having me.
So obviously we are seeing a lot of these cases in North Carolina and South Carolina. What is whooping cough?
So whooping cough is a highly contagious bacterial infection caused by a bacteria called Bordetella pertussis, and it is spread throughout the respiratory system, mainly by coughing, sneezing, and being in contact with the infected person.
What symptoms can you expect to see?
So as the name suggests, the whooping cough, you basically go through 3 stages. The first is what we call a catarrhal phase, where there's a runny nose, cough, some sneezing, low-grade fever. That lasts anywhere from a week to 2 weeks. Right after that is called the paroxysmal phase, where there's a classic cough followed by a whoop sound, and that lasts anywhere from 2 to 6 weeks. And after that is the recovery phase or convalescent phase, which can last up to a few months of cough.
And this can be very dangerous for certain populations,
right,
like babies, right?
Yes, absolutely. The vaccination only starts at 2 months of age, so newborns are not protected. So all the more important for adults, caregivers, grandparents to be vaccinated, especially around newborn babies.
If you're experiencing some of these symptoms, at what point should you seek extra care?
I think when you do have a week of cough and cold symptoms and you're not getting any better, that's a really good time to check in with your physician rather than just going and getting over-the-counter medications without talking to us, because there are some classic symptoms that will point us towards getting the patient tested, and there's a very effective treatment. There are very good antibiotics, the macrolide group like azithromycin or Z-Pak, that's very effective against whooping cough.
I've heard sometimes you're not supposed to take cough medicine. Is that true, and why?
Right, I mean, cough medication only masks the cough or the symptom, but in whooping cough, the cough is so severe that I don't think cough medicines really do anything besides just make us drowsy. So we really refrain from that and getting appropriate treatment, hydration, supportive care, rest, and vaccination is the best defense against the disease.
So what are the vaccinations, and when should people get those?
Okay, so there are 2 vaccinations. There's the DTaP and then there's the Tdap. The DTaP is given to infants 2 months and up. The schedule is 2 months, 4 months, 6 months, 15 to 18 months, and 4 to 6 years of age. And the second one is the Tdap, which is given to preteens, young adults, and adults. And that is usually once as an adult and then repeated every 10 years. And pregnant women in pregnancy, every pregnancy must get vaccinated with the Tdap vaccine, usually in the 3rd trimester between 28 and 36 weeks.
And you said it weans after 10 years typically?
It can wean earlier depending on the person's immunity. Basically, it depends on your building up your own antibodies as a line of defense. So that's why, you know, it's recommended to get periodic boosters.
Okay, good to know. Well, thank you so much, Dr. Bajor, for joining us and filling us in on that.
Absolutely. Thank you.